The Dr. Fazil TV show is brought to you by POYA, People of Yuma Health Association. The Dr. Fazil TV show is intended for health educational purposes only and complies with all the HIPAA regulations.
Hey, good afternoon, everybody. We are on time. Weather looks smooth. We're going to land successfully. Another general question, knowledge question. I was talking to Christian the other day, and it happened to me. I saw a movie. It was a documentary movie. And again, it's nothing related with this topic. Just get your mood a little bit lighten up. How many people are familiar with Chicago? Obviously, most people, right? What is it famous for, mostly speaking? Michael Jordan, right? He talked about Al Capone. You know, the Al Capone, and here's the thing. Somebody asked me, can we diagnose dementia, like loss of memory, which is pretty common, because as we're living longer and longer, our memory is not as much as it used to be. So is an MRI or any imaging study of the brain is good enough to make a final diagnosis on a loss of memory? Is that the fact? And my answer was it's not, because there's a lot of things you can see on MRI, which like strokes, brain tumors, high pressure in the brain, lack of blood supply, which are common causes of dementia. But certain things you cannot diagnose, which are reversible actually. It's good to have dementia because of those reasons, because you can fix them. Like your thyroid function, your thyroid gland in the neck, if it is off, way off, I have seen few patients in my practice, it was in hundreds, and the treatment was simple, Synthroid, and it can bring you memory just like that. Now, STD, one of the STD, syphilis. Now, if somebody got, and I'm not saying it that somebody got it, but I'm just saying somebody if had it in the past, because now it's such a preventable disease, it has different phases: primary phase, secondary, and tertiary. Now, the primary phase is actually when you see it, well, there's a spot, and secondary phase comes and goes, and you have some symptoms that wouldn't know that. Tertiary syphilis, which is the late phase of syphilis, happens years after. You probably wouldn't even remember that you had a syphilis. 15 years after the first time you got it. And it affects the brain, and it causes loss of memory. The treatment is very simple. If you know what you're looking for, there's a simple blood test, and then you just give, kind of like penicillin or doxycycline, like it's an antibiotic, and you can fix your syphilis. Al Capone, they couldn't get him, so they got him for tax evasion. He got in Alcatraz. How many people got to San Francisco? You were there, right? Julio put his hand out. No, I'm sure it's a historical thing. I mean, it's a big thing in the Golden Bridge in San Francisco and that the island, that they got him on tax evasion. So he got 11 years and he came out on 7 years for good behavior. The reason he have good behavior because his brain was all screwed up because of neurosyphilis. He got syphilis in his brain, could do nothing bad in the prison because he lost his memory. And then he died of that. By the time he got out, and by the time they found the treatment, he was dead. So it happens to everybody, or could happen to anybody. I'm just saying. So that's why when we see somebody complain of loss of memory, we take it seriously. There are other causes of brain loss of memory. I mean, as I said, Lyme's disease. Now, Lyme's disease is a disease caused by ticks. It is, somebody on the East Coast where there's a lot of forests, you can get bitten by a tick, have a little rash, then it goes away. Years later, it can cause heart blocks and a lot of heart problems. And treatment is simple. If you know what you're looking for, you can fix it. But if you're randomly putting pacemakers and blah, blah, blah things, then you will never find the right problem, right diagnosis, and you will never fix it. Heart blocks are caused by Lyme disease also. And the treatment is doxycycline. So when I was getting my training, when I was resident and doing my fellowship, And then you have to take your medical boards. Like when you become a doctor, you have to take your medical boards. So then you go to a little, like a boot camp, where you get training or refresher training in 3 days. So one of my instructor told me that if you don't know what you're treating infection wise, just give doxycycline. It cures everything. Rule of the thumb. And you can tell Lyme disease and syphilis both you can fix with doxycycline. And there are a lot of other diseases which are out there which we don't know. So if you have to take a wild guess, ask for doxycycline. All right, let's go to the next. Uh, Again, I have to put disclaimer. I'm not being paid. I'm not billing you guys for that. You didn't pay me for anything. This is my goodwill, your goodwill to be here together for knowledge sake. And this is what I like to do. And I'm sure you guys enjoy it, or I hope you enjoy it. Before I go further, I want to repeat the basic definition, because most people will ask, what is the ideal body weight for me? And I think that has changed. The ideal body weight it depends on your height and age and everything. So, or mostly the height. A concept in medicine known as BMI, body mass index, is a ratio between your height and weight. So just remember, 25 is good. 25 to 30 is kind of okay. Above 30 is obesity. Less than 25, you're on the wrong side of the fence. I mean, you have room to gain weight. So 25 it's easy to remember round figures. I know the decimals in there, but 25, 30, but just remember those two numbers. 25 is good, less than 25 is too low, 25 to 30 is overweight, above 30 is obesity. Simple as that. Before we say what medication causes weight loss, because we have not discussed this case or this topic in the past, we always have discussed the supplements and other things, but I wanted to add a little bit more knowledge to our weight loss seminars. I think we skipped this medicine portion. The reason we skipped it is because it's a little bit more designed for the medical professionals. So I tried to simplify it, and also I removed those medications which are not covered by the insurances, because there's no point of discussing medications, hypothetically speaking, if they're not even covered or not affordable. What's the point, right? So it's a practical approach. I'm going to keep it simple. I think the most important thing is, before we go to the weight loss medication, is that we want to keep it organic and natural. And medication are short term and they have side effects. So the whole idea is to have less medication, not more medication. So I think it would be appropriate to say what medication causes weight gain, so we can start to get rid of them first, if we can, in a safely under doctors or provider supervision. So there's a list. There's quite a bit of list, but I picked up the most common one. Like, first we have to see, how do medication cause weight gain, and what are those common medications? The most common one is steroids, like prednisone, and the prednisone comes in different fashions. I mean, Flomax, which is a nasal spray, that can even affect your weight gain. Some people have to take prednisone for a longer duration, like kidney transplant or heart transplant, liver transplant patient. I saw a patient who have a bad osteoarthritis, and then nothing would work but just a long-term low-dose prednisone. I have seen a patient who have some kind of inflammation in the arteries, and she's been on 20 milligram of prednisone once a day. That weight loss would be very hard to do, very, very hard to do. As a matter of fact, I was on Wednesday, I saw a patient, the patient I saw, he has a bladder cancer. It got spread to the intestine, and he came for second opinion, and we got him squared away. Before I was leaving, one of the realtor came in, and for not my patient, for something else, she said, "Hey, I just want to swing by." Then she started to say, "Well, I want to do my weight loss." And I say, "Well, I understand, but I mean, I don't know your history. I wouldn't, there's a whole process. I wouldn't just jump on giving you opinions." Then she said she has breast cancer. I said, is it under remission? She said, it is under remission, and she's taking a medication that causes weight gain. And she have to take it for 2 more years. And I said, listen, weight loss is good. It's good to look nice aesthetically and everything, and then it has its own benefit, medical benefit. But in your case, stopping that medication just for heck of losing weight would be dangerous. Please don't do it. I mean, let 2 more years go by, and then we can do whatever you want to do, and that should be fine. So again, we have to be careful not stopping the medication which causes weight gain, because they might have some dangerous side effect if we stop it abruptly or without any supervision. Now, antihistamines like Benadryl also causes increased appetite. How they cause weight gain? They make you eat more. You feel more hungry. So that's the mechanism. Now, people who have allergies, they take, like a Benadryl or ceftriaxone. Those medications are antihistamine. They are available over the counter. One thing I do commonly in a situation like that, I tell them up front, it's going to be a long haul. So why don't we do this thing? Fix your allergies. Maybe you don't have to take those medications, and then you will lose weight without doing anything else. Sometimes simple, we'll call it KISS, case, keep it simple and stupid, I guess. So that's the concept. I mean, if it's simple to deploy, it's going to work, it's going to stick. It's more complicated, the compliance issue is going to be there. So next is fluid retention or constipation also, we can say that. Steroids cause fluid retention. There's blood pressure medication, amlodipine, Norvasc, and I can tell you quite a bit of patients that are on those medications. They get swelling in the legs, and that's what they see, but they get swelling everywhere else, which they don't see. And they can easily add 10 to 15 pounds on your weight gain. Very hard to get rid of that weight. You wouldn't be able to get rid of that weight unless you lose medication. So what my goal is, generally put on an alternative medication which can lower the blood pressure but wouldn't cause a weight gain, and then they start to lose weight also by just changing the medication. Gabapentin is very common. Lyrica is very common. We use it for neuropathy. Same thing, fluid retention. And the legs, you can see they look swollen. That would not respond to water pills. This is not going to work with the water pills. So I don't put on the water pills for that reason. Insulin is an anabolic hormone. Remember that. People who take insulin, they can gain weight by numerous means. First, if you're taking too much insulin, what's going to happen? Your sugar is going to drop. What's going to happen then? You're going to eat more. Then what's going to happen? You're going to need more insulin. It's a vicious cycle. So sometime, and if the doctors are not careful or providers are not careful, they get into that death spiral, or they just keep increasing insulin. Patient keep getting hypoglycemic. They eat more. The sugar goes up. They keep increasing. So that's one effect. And the second effect is insulin by itself causes this thing. So there's something known as hypertrophy. The fat cells, they don't grow. Once you have them, they're going to stay. If you have 100 cells, you will remain on 100 cells in your belly. I'm giving an example. So what they happen is the cells don't change in the numbers. They just swell up. They become hypertrophic. So, and insulin causes that. So if we can, one way or the other, get rid of insulin. I understand in type 1 diabetes, you have to take insulin. Point I'm trying to make is that if you're seeing another doctors or another providers, sometime if they are in a rush and not getting good history, they might be forgetting that that's where the problem is. We got to lower the insulin, not increase the insulin, and lower the food intake, and that should help. Now, slower metabolism. Sometimes we have an internal furnace, we burn fat, and some medication like beta blockers like propranolol or toprol or metoprolol can lower your burning rate. That can also cause weight gain. Now let's go to the topic of the day. So this was just an example, like if you're fast metabolizer versus slow metabolizer, you're gonna gain weight or not. Here it goes. All right. Now let's talk about the real topic. What are the medications which people seek? Phentermine. Now, phentermine is a controlled substance. It has to be prescribed. Is the reason it is prescribed? It is addictive. It has a side effect. It mimics like amphetamine. So instead of Arizona, you can only be prescribed 1 month in a year. I mean, that's the regulation. And now people, I know not everybody follows the regulations. And and if you do more, then the DEA will call you and ask like why you giving more unless you have to justify it. But there's a good reason they put a restriction on it, because it can cause strokes, addiction, heart attacks, stuff like that. So I generally don't use it as a first go, because I know what we're gonna do in the second month is not gonna work. If it's not gonna work, it's not gonna work. Sometimes I see people are struggling and they are just on the plateau, just need a little push. At that time I use it. Obviously we have to make sure there's no contraindication. There should be not any atrial fibrillation, no strokes, no heart attacks. The blood pressure should be controlled, and we let them know it's going to be only for 1 month. Don't ask till next year. Now, on the footnote, there's clinics, and you can Google search phentermine clinics. Now they keep giving forever, and people lose weight and they love it. And the reason they love it, because how it works is it lowers your appetite. How they get away with it? I mean, I think they buy from the vendors and then they sell it in the clinic. Since there's no prescription written, you're not going to the pharmacy, so they stay under the radar. Because every time you write a controlled substance, you go to the pharmacy, they have to report the DEA website, the controlled substance. They go to their website, so it gets flagged. So again, I'm not saying where the loophole is. I'm saying what the right way to do it and what the wrong way people are doing it. So sometimes you analyze the Google search keywords, and when you do the weight loss and see how many searches are coming with the phentermine clinic, you will be amazed. Like, this is the first thing people think, phentermine clinic, because they just give it away just like candies. But remember, if you happen to end up that kind of clinic, you might lose weight for good. I mean, it can kill you. So it can cause strokes, hypertension, heart attacks. So please be aware of that. Don't just be. I mean, I know you're gonna feel good because you're not hungry, you're active, you're losing weight without doing anything, but the risk is high. And again, let's go back to the history. In 1970, there was a medication known as fen-phen. Phentermine was part of it, and there was another medication, fenfluramine. That's why the name came fen-phen. It was started as a fenfluramine without phentermine. In 1990, they mixed together those two medications and heavily marketed it. When they heavily marketed it, a lot of people start to use it. When a lot of people will use it, even a small side effect will become very evident, because now a lot of people are using it. A lot of people died because of heart failure, because of the valve dysfunctions of the heart, and also pulmonary hypertension. And there was a big lawsuits, and I mean, it was like a nightmare, and class action lawsuits. And I think in 2005 they stopped using fen-phen. It's banned. But phentermine was part of it. But they found the phentermine was not the culprit. It was the fenfluramine, which is an antidepressant medication. So, but it has a very, very bad side effect. So they kind of like a lot of people use it. I know one patient which survived, and she have a heart transplant now. And was it worth it? No. Having heart transplant for weight loss? No. Was it her fault? No, because she didn't know it. Was it doctor's fault? I guess no, because they didn't know either. Whose fault was it? It was probably the pharmaceutical company's fault, because they probably knew it. They didn't just disclose it. It might be too small side effect, ain't gonna happen, 1 in a million. But when you use 20 million people, then that's a lot of patients actually. Anyway, so let's go to the next slide. It comes in different doses. The dose which we recommend is 37.5 milligram tablet once a day. Take in the morning. Don't take at night. You're going to be awake all night long. So it is approved only for short-term use. There's some medication, we'll talk about it, they are used for long-term use too, but this is used only for 1 month. Side effects, again, dry mouth, sleeping problems, dizziness, heart palpitation, flushing of the skin, fatigue, constipation, irritability. So some patients have more, some patients don't complain it. So, but it can happen. So now let's talk about Topamax. Topamax is also, I know some of patients or some of the audience might be familiar with word Topamax. Topramate is an anti-epileptic medication, antidepressant medication. It's commonly used by neurologists. So Topamax in combination with phentermine has been approved by the FDA for long-term weight loss use. So let's say if you want to try something, you can try something known as Kismia, and Kismia is a medication which is a brand, although inside is just phentermine and topramate, so they're very cheap. So Kismia would not be covered by your insurance. So if we have to use it, we might have to do some like our individual thing. Okay, I'll write you a separate prescription for phentermine. I write you a separate prescription for Topamax. And the regimen was so complex that just in case somebody wanted to ask, I wouldn't remember that, so I actually just printed it out. I have it with me, like how you're gonna make this cocktail, because it dose changes every week, you know. So that's why they combined it, because it is so difficult to remember. They mix them together, and they got a patent on it, and then the price went skyrocketing. But inside is the same combination. So if you can write two prescriptions and write a good instructions, patient can take those two medications separately, and we can have that good benefit of weight loss for long-term use. That's the bottle, and you can see 15 milligram/92. That is your phentermine 15 milligram tablet, and then the next is topramate. So it has two combination, and it escalates every week. You know, slowly it escalates. That's how it's given. Valbuteron is also an antidepressant medication. And the way it works is lowers your appetite. And that's how it looks like. Generally, the dose is 150 milligram twice a day or 300 milligram once a day. I recommend taking in the morning. It causes lack of sleep, so it is also used for weight loss. How it works? Most of these medications work. None of the medications for weight loss make you increase your metabolism. All of them actually lower your appetite. That's all they work. They have no other mechanism of action. So all the weight loss medication in the market will cause your appetite to be less. So if you can control your mind by willpower, that's all you need. You don't need any medication. But if you need it, then you got it. And these medications are covered by insurances, so that's why I put it on the slide. There are a lot of exotic medications which are out there. They have some effect, but I didn't write it because it is a moot point. It would not be covered by insurance. Or cash payment would be too expensive to use it for long term. It's also known as Zyban, twice a day, 150 milligram, or once a day, 300 milligram is a dose. The studies have shown that it will have you lose 10% of your initial body weight initially. So if you have 200 pounds, you will probably lose 20 pounds in the first few weeks by using this medication. I think the weight loss is all a boring game, just like going to the gym. You know, you're just doing exercise. The reason that it is boring, you're doing it by yourself. Nobody's your partner there. Results are slow. It's painful, you know, but eventually it pays out. So you have to keep your mind on the track. You know, as long as you keep doing it, you will see it. Once you have done it, now you're a pro, because you know your body, how it works. You have learned the system, and you know you can always do it because you've done it in the past. So first time is important. So sometimes we use this medication to somebody like they're trying their hard, but they're not getting it, and they're at that snapping point. So we just give them a little push, so they can see a positive response, and they become believers, and then now they can do it. Then you just stop the medication. They can start doing it. It's like giving a little push to a car who needs a little push, you know. All right. So we're almost toward the end. Velbuteron plus naltrexone, known as Contriv. Again, they are available separately. Naltrexone is an antidote for narcotics. So if you give to somebody who's taking opiate, they're going to hate you. They're going to really hate the doctor because they're going to go to such a withdrawal. So it's really important before somebody prescribes this medication, ask them if they're taking medication for pain management because it's going to put them into withdrawal in a second. And say, forget about weight loss, where's the doctor? So I just want to make sure that if somebody gives it to you, please let them know, hey, by the way, I'm also taking oxycodone or Tylenol number 3 or Norco or hydrocodone or whatever for pain management, because it will put you into real withdrawals real fast. So, but it comes in a combination, too expensive, but they can be prescribed separately. Again, there's a weird combination dosing regimen. I printed them out. If somebody want to look into that, I have it here. It was out of the scope of the audience. I didn't put on the slideshow. So as long as you guys know the name and ask the doctor if you are on pain management, or tell the doctor, or your provider has to, anybody, and nurse practitioner, PA. Well, thank you for coming in. I loved it. I hope you enjoyed it. Thanks so much.